Hello everyone, I'm Anastasia signing in from NORAS. In our previous session, as we have started discussing about the hot and cold application, we have come to know what are the principles, what are the therapeutic use, as well as we have discussed in detail about the hot application. In this session, we will be discussing about the cold application. Here, the application of cold is the use of an agent that is cooler than the body surface. This application can either be done in a dry or moist form, as well as it can produce a local systematic effect or even both. So here, depending on the condition of the patient, we will be choosing when is it required to provide this cold application. The local application of cold to small areas of the body can be given in different ways. For example, ice chips can be given by mouth. Ice soaks can be provided to an injured extremities, as well as we can also provide the ice compress, ice packs, or even the ice bags depending on the condition as well as to which part is this cold application required to be administered or to be provided. For which condition is this cold application indicated? This application of coal is indicated if a person is having sprains or fracture, localized hemorrhage, for example, nose bleeding or even hematoma. Because here, by providing the coal application, it would result in vasoconstriction. So here, if a person is having nose bleeding or even hematoma, we can stop the bleeding by providing the cold application. Localized wound, insect bites, minor burns, and even after injections. If a person is having muscle spasm, if he or she is having headache or maybe pain due to malignancy, if a person is having low and moderate pyrexia, or if there is dental extraction and surgical repair. So these are the various conditions for which this application of coal will be indicated. Now, along with this, there are also certain contraindications whereby if a person is having certain condition or if a person is having certain problems, then this application of coal may also be contraindicated. The first one is the disorders that result in impaired circulation. Here, as we have come to know that by providing these coal application, it would lead to vasoconstriction, which would further reduce the blood flow to the area. So here, if a person is suffering from any disorders or even conditions that results in impaired circulation, for example, diabetes mellitus, then application of coal to these kind of patients will be contraindicated. This coal application may also be applied initially to a burn area in order to reduce the pain as well as to decrease the effect of hypoxia. However, after 24 hours, this application of coal will be contraindicated as it may delay the healing process. So here, if you are thinking of applying the coal application to the burn area, you can do it in order to reduce the pain, in order to decrease the effect of hypoxia, but this must only be done 24 hours before. Once it has reached to 24 hours, then we should not apply the coal application. If the patient is having an infected wound, or even if a patient is having a decreased sensation on the affected area, then the application of coal will also be contraindicated. So these are the various conditions for which this application of coal will be contraindicated. I hope till here you have got a clear understanding why this coal application is being provided, for whom is it indicated, as well as for which conditions is it contraindicated. Now let us move on to the types of coal application. So here there are different types. The first one is by providing the ice bag or ice collar. The second is by providing the coal compress. The third is by providing the coal packs and also by providing the ice packs. And we can also provide this coal application by tepid sponging. So in order to get a clear idea, let us discuss about each in detail. Starting with the first, which is the ice bag and the ice collar. So these are used for the local application of coal to small areas of the body. The articles which would be required for performing this procedure includes a big bowl, an ice bag with cover, a Macintosh with a towel, a roll bandage, a small container with salt, a small spoon, a duster, small ice cube, a kidney tray, or even a paper bag. So these are the articles that would be required for providing this coal application through the ice bag or the ice collar. Now let us discuss about the procedure. Here, the first thing that you as a nurse must do is you must identify the patient. You must explain the procedure to the patient. You must make sure that you place them in a comfortable position. You must prevent draughts by covering the patient with a blanket or the bed cover. Then you must start breaking the ice into small pieces. Here, while you are breaking these ice, you must make sure that you place them in a bowl for some times in order to smoothen the sharp edges so that it would be easy to insert these ice cubes into the bag, and also it would be easier to mold the bag to a body part. So that is why it is very important that these ice cubes must be broken as well as kept in a bowl for some times in order to smoothen the sharp edges. And once this has been done, you can sprinkle salt from above in order to prevent the ice from melting. You must then check the ice bag for presence of any leakage by pouring water into it. Here, if the bag is not leaking, you can then empty the bag and fill it with 1/3 of ice. You must place the bag in a flat surface and squeeze the air, after which you must screw the cap well. You must wipe it dry and then invert it upside down in order to check if there is any leakage. You must put on a flannel cover. Then you must spread a Macintosh as well as a towel on the bed of the patient, after which you can apply this ice bag or the ice collar on the area required. So while providing this ice bag or ice collar, here it is very important for you to remember that it must be provided only for a duration of 30 minutes, after which it must be discontinued for at least a period of 1 hour for the recovery. Here, once this is done, you must then chart down this application as well as its effect. You must wash the bag with soap and water and then dry it. And once it is dry, you must sprinkle it with powder as well as fill the bag with air. So these are the various steps that you as a nurse must follow when you are providing the ice bag or the ice collar to the patient. Now let us move on to the second method of application of coal, which is by providing the coal compress. This is a local moist coal application made out of folded layers of gauze, linen pieces as well as soft linens. Here, what we will be doing is by taking the folded layers of gauze, linen pieces, or the soft linen, we will cool it over the ice chips, wring out, and then it can be applied. However, while applying the cold compress, we as nurses must make sure that we replace it as it becomes warm. The main purpose of providing this cold compress is to treat epistaxis, to provide moist cool to the eyes, as well as to apply it on the forehead in order to reduce the body temperature. So here the articles which would be required for this procedure include a bowl of water containing ice. We also need several pieces of gauze, a non-absorbent cotton balls, a Macintosh and a towel, as well as a kidney tray. So these are the articles which would be required. Now moving on to the procedure. Here again, the first thing that we must do is we must identify the correct patient. We must explain the procedure to the patient. We must provide privacy. We must make sure that they are placed in a comfortable position. We must place the equipments in the patient's bedside. We must screen the patient if required, as well as pluck the cotton balls in their ears in order to prevent the water from entering. We must also place a Macintosh and a towel over the pillow or over the bed of the patient. We must then dip the gauze pieces into the bowl containing water. Here, once we have dipped it in the water, we must take it out, squeeze it, and then apply it to the area required. So here it is also very important that we must keep on replacing this compress as it becomes warm, and on completion of treatment, we must remove as well as clean the equipments. We must replace the equipments in their proper places. We must make the patient comfortable. We must wash our hands as well as document the procedure in the nurse's record sheet. So these are the steps that we must follow. However, while we are providing this cold compress, there are special points that we need to keep in mind. The first one is we must never cover a cold compress as it will soon reach the body temperature. This cold compress must only be provided for a duration of 15 to 20 minutes. While providing this cold compress, we must also observe if there is presence of numbness as well as signs of mottled bluish appearance. These are the various points that you must keep in mind while providing the cold compress. Now let us move on to the next method, which is the application of cold pack. Here, the methods which we would be following or the steps which we would be following for providing the cold packs is similar to the ones which we will be following for providing the local moist hot packs. So this cold packs can be provided by using a washcloth, towel or sheet depending on the area for which this application is provided. So here, if the area is small, then we can only take a washcloth and we can provide the cold pack by using it. However, if the area is larger, then we can also take a sheet. So here, depending on the area for which this cold pack is to be applied, we will be choosing which cloth or which linen is to be used. Here, a basin of cold water will be prepared where ice chips or even ice packs would be immersed in it, and once it is cool, the excess water will be squeezed out and the pack can then be applied to the affected area. Here it must be noted that the temperature of the water must be maintained at 75 degrees Fahrenheit, and also these cold packs must be replaced as soon as it becomes warm or as necessary in order to maintain the coolness. This is about the cold packs. Now let us move on to the next one, which is the ice packs. Here, these ice packs are mainly given in order to reduce swelling or to control bleeding. Here, a plastic bag of ice covered with a pillowcase or a towel can be applied to the affected area. Now let us discuss about the general moist cold application that can be provided by tepid sponging. This tepid sponging is a moist cold application which is mainly provided in order to reduce the body temperature of an individual. This is mainly provided to those people who are suffering from hyperpyrexia. The main reason of providing the tepid sponging is to soothe the nerves as well as to promote healing, to relieve the presence of discomfort, as well as to reduce the body temperature. So here for providing the tepid sponging, there are various articles which would be required. Here we would be needing a basin with tap water, a long Macintosh with 2 bath blankets, a bottle of spirit, a bath towel, sponge clothes as well as 2 treatment towels in order to use it as a compress, a glass of water, and a TPR tray. So here these are the articles which would be required. And then when we talk about the procedure, first thing that we must do is we must identify the correct patient. We must explain the procedure to the patient. We must place them in a comfortable position. We must provide privacy to the patient. We must assess their vital signs. We must place a Macintosh on the bed of the patient. We must fold the bedclothes at the foot of the bed. We must cover the patient with a top sheet. We must remove their clothes. We must wet the large areas of the body at one time in order to permit the heat of the body to transfer to the cooler solution on the body surface. We must often wet the sponge pads and apply it to the forehead, the neck, the axilla, the groin, as well as the ankles. Since the blood circulation here is closer to the skin surface, we must then follow the steps which we would be doing in providing a sponge bath. We must use a long stroke for sponging and avoid the circular motion as it can cause friction while providing the tepid sponge bath. Here we must make sure that we only wet the skin and not dry it. We must also assess their vital signs in between the procedure. It must also be noted that this temperature can be carried out for 20 to 30 minutes. It must be stopped if a person starts shivering, or it can also be stopped if the patient has reached the desired temperature. So here, if the patient has reached the desired temperature, we can stop this procedure as well as we can help them in drying themselves. As a nurse, we must assist the patient in removing their wet clothes. We must make sure that they put on clean clothes. We must place them in a comfortable position, after which we can then perform hand washing and then chart down the procedure in the nurse's record sheet. Here, as a nurse, it is also our responsibility to assist them in removing their wet clothes. We must make sure that they put on their clean clothes, and also we must place them in a comfortable position. We must replace back all the articles. We must wash our hands. We must assess their vital signs as well as document the procedure in the nurse's record sheet. And also here for these patients, it is important that their temperature must be assessed every 30 minutes for 1 hour and then an interval of 1 to 2 hours. Again, here, while providing the tepid sponge bath, there are certain points that we must keep in mind. The first one is we as nurses must always observe the patient throughout the procedure. Here, not only just as we are providing the procedure, but even after this procedure has been performed, we must keep on assessing as well as observing their condition. Not only that, but while providing this tepid sponge bath, we must avoid unnecessary exposure. We must prevent friction. And as I've also told you that this procedure can be carried out for 20 to 30 minutes. Here, it can also be discontinued as soon as the patient complains of any untoward reactions. So here, if a patient is complaining that he or she is getting chills, if he or she starts shivering, then also this tepid sponge bath must immediately be discontinued. So here, these are the points that you must keep in mind. Now we have come to the end of this topic, whereby in today's session we have discussed in detail about the cold application. Here we have come to know what it is, what is the reason of providing the cold application, as well as we have discussed about the types in detail. So I hope you have got a clear understanding of this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.